What your eyes, nails, and pillows say about your heart. Doctor explains. The human heart is an extraordinary organ, a tireless muscle that beats approximately 100,000 times a day, pumping life-sustaining blood throughout our bodies. It's a marvel of biological engineering, yet despite its critical role, many people remain unaware of the silent threats that can compromise its function. Heart disease, a broad term encompassing a range of conditions affecting the heart, is far more prevalent than most individuals realize. In fact, startling statistics reveal that around half of American adults over the age of 40 may be living with some form of hidden or undiagnosed heart disease. Imagine the sheer scale of that number. Tens of millions of people, potentially including yourself or someone you cherish, are currently navigating their daily lives with a heart condition they know absolutely nothing about. This silent epidemic underscores the urgent need for greater awareness and understanding of the subtle indicators our bodies might be presenting. As a medical professional dedicated to diagnosing and treating heart conditions daily, I've observed firsthand how often vital clues are overlooked or misinterpreted. Many of these early warning signs are not dramatic chest pains or sudden collapses, but rather subtle changes in our physical appearance, daily habits, or functional capacity. These aren't obscure medical phenomena. They are tangible signs that, once you're aware of them, you can look for right now in your own body or in those you care about. These are the very same indicators I meticulously assess when evaluating my own patients, and the good news is, you don't need years of medical training to recognize them. By paying closer attention to these often ignored details, you can gain invaluable insights into your cardiac health. Let's delve into these 7 revealing signs, starting with one that might seem surprisingly domestic. Our first sign involves a seemingly innocuous aspect of your nightly routine: the number of pillows you use. It might sound like a peculiar question, and I often encounter bemused expressions when I inquire about it. But this seemingly simple query has proven to be one of the most remarkably insightful tools for identifying hidden heart failure. The real question beneath this query is deeper. Are you able to lie completely flat in bed and breathe with ease and comfort? Or do you find yourself becoming notably short of breath when you assume a horizontal position? This symptom, medically termed orthopnea, is a classic indicator of a heart that is struggling to perform its fundamental task. The heart's primary function is to efficiently circulate blood from the lungs, where it picks up oxygen, to the rest of the body, and then return deoxygenated blood back to the lungs. When the heart's pumping efficiency begins to falter, blood can start to accumulate or back up into the pulmonary circulation, the network of blood vessels within the lungs. As this pressure increases within the delicate capillaries of the lungs, fluid can leak out of the blood vessels and permeate into the surrounding lung tissue. This accumulation of fluid within the lungs is known as pulmonary edema. When you are in an upright position, gravity naturally assists by pulling some of this excess fluid downwards towards the base of the lungs, making breathing somewhat less strenuous. However, when you lie flat, gravity's influence changes. The fluid within the lungs spreads more evenly throughout the entire lung field. This widespread fluid effectively creates a barrier, making the exchange of oxygen and carbon dioxide much more difficult, akin to trying to breathe with a thin layer of water coating the inside of your lungs. The tricky aspect of this condition is its often insidious onset. Pulmonary edema usually doesn't appear suddenly overnight. Instead, the changes happen gradually, almost imperceptibly. Individuals might not consciously register that they are becoming short of breath when lying flat. What they do notice, however, is that they feel more comfortable and breathe more easily with an extra pillow. Over time, one pillow turns into 2, then 3, or even more, or they might resort to sleeping in a recliner chair. They often attribute this change to simply finding a more comfortable sleeping position without connecting it to any underlying health issue. Recognizing this common misinterpretation, I shifted my approach. Rather than asking, Do you feel breathless lying down, which many patients didn't identify with? I started asking, how many pillows do you sleep with? This subtle change in questioning often yields much more revealing information about their respiratory comfort in a supine position. So, take a moment to reflect. Could you comfortably sleep completely flat tonight, or do you rely on multiple pillows to breathe easily through the night? A change in this seemingly trivial habit could be a significant clue. Our second sign prompts another seemingly straightforward question. Can you climb a flight of stairs without unusual difficulty? Again, this might strike you as a basic inquiry, yet its significance in assessing cardiac health is profound. Many individuals living with significant, even advanced heart disease can navigate their daily lives feeling completely normal. They can go about their shopping, attend work, and take leisurely strolls around their neighborhood without experiencing any overt symptoms. I have encountered patients with substantial cardiac impairment who could still walk a mile without any obvious problems. However, the dynamics shift dramatically when it comes to climbing stairs or walking uphill. These activities impose a considerably greater demand on the cardiovascular system, requiring the heart to work harder and pump more blood to meet the increased oxygen needs of working muscles. It is often during these moments of increased exertion that the earliest and most telling symptoms of heart disease first emerge. If you find yourself experiencing an unusual degree of shortness of breath, disproportionate fatigue, or even chest discomfort after ascending just a single flight of stairs, especially if this represents a noticeable decline from your usual level of fitness or your historical capabilities, it is an observation that warrants serious attention. The heart, much like any other muscle, can compensate for a time, performing adequately under normal resting conditions. But when it is pushed even a little harder, the subtle signs of its struggling capacity can become manifest. This change in exertional tolerance is a crucial indicator that your heart might not be as robust as it once was, signaling a need for further investigation into its functional integrity. Moving on to our third sign, a visual check that is remarkably simple and requires no special equipment. Are your ankles swollen? This is one of the easiest physical signs to check for yourself, and it often reveals itself through subtle, everyday observations. Perhaps you've noticed that your shoes, which once fit perfectly, now feel uncomfortably tight towards the end of the day. Or maybe your socks leave unusually deep, persistent indentations around your ankles and lower legs after you take them off. These seemingly minor occurrences can be indicators of something called pitting edema. You can actively test for pitting edema right now. Using your thumb, press firmly on the skin over your ankle or shin bone for approximately 15 to 30 seconds. Then, release the pressure. If a noticeable dent or indentation remains in the skin for a few moments after you remove your thumb, that's what we refer to as pitting edema. What you are witnessing is fluid that has leaked out of the tiny blood vessels, capillaries, and collected within the interstitial tissues beneath the skin. This fluid accumulation is often a consequence of blood backing up in the venous system because the heart, particularly the right side, is not pumping blood effectively enough to return it to the lungs. It's the same fundamental physiological process we discussed earlier with fluid buildup in the lungs, but in this case, gravity pulls the excess fluid downwards into the lower extremities. It's important to understand that swelling or edema in the ankles doesn't automatically equate to heart disease. There are several other conditions that can cause it, including kidney disease, where the kidneys fail to remove excess fluid, liver disease, leading to reduced production of proteins that keep fluid in blood vessels, pregnancy, due to hormonal changes and increased blood volume, venous insufficiency, where leg veins struggle to return blood to the heart, and even certain medications or prolonged periods of standing. However, if this sign is present in conjunction with some of the other indicators discussed in this video, it should indeed raise a significant red flag and prompt a conversation with your healthcare provider. The presence of pitting edema, especially if it's new or worsening, is a clear signal that your body's fluid balance or circulatory system requires evaluation. Our fourth crucial indicator involves the rhythm of your heartbeat. Is your pulse regular? There's a significant heart condition that you can screen for right now, needing nothing more than your own fingers. To perform this simple check, place 3 fingers, your index, middle, and ring fingers, gently on the radial artery in your wrist, just below the base of your thumb, as demonstrated. Take a moment to locate your pulse, feeling the steady throb of blood against your fingertips. Once you've found it, focus your attention on the rhythm. Does it feel consistent and regular, like a metronome keeping perfect time? Or does it seem erratic, completely unpredictable, perhaps skipping beats or speeding up and slowing down without any discernible pattern? If your pulse feels distinctly irregular, you could be experiencing a condition known as atrial fibrillation, often abbreviated as AFib. To understand why this matters, let's briefly consider the heart's sophisticated electrical system. The heart is composed of 4 chambers, 2 upper chambers called atria and 2 lower chambers called ventricles. Normally, the heart's natural pacemaker, the sinoatrial node, generates precise electrical impulses that travel in an organized fashion, coordinating the contraction of all 4 chambers. This synchronized action ensures efficient blood pumping. However, in atrial fibrillation, the atria, the upper chambers, start firing chaotic and disorganized electrical signals. Instead of contracting properly in a coordinated squeeze, they begin to twitch or fibrillate in a quivering motion. This chaotic electrical activity leads to the irregular and often rapid pulse you might feel at your wrist. The critical reason why detecting an irregular pulse like this is so important lies in its potential complications. When the atria are merely quivering instead of fully contracting, blood can pool and stagnate within these chambers, particularly in a small pouch-like structure called the left atrial appendage. Stagnant blood is prone to forming clots. These blood clots, once formed, can dislodge and travel through the bloodstream. If a clot makes its way to the brain, it can block a blood vessel, leading to an ischemic stroke, a devastating event that can cause permanent disability or even death. Furthermore, clots can travel to other parts of the body. If one blocks blood flow to the intestines, it can cause a severe and potentially life-threatening condition called bowel ischemia, or if it reaches a limb, it can cause acute limb ischemia. The good news is that modern technology has provided us with tools like many smartwatches and fitness trackers that can detect irregular heart rhythms and alert you to their presence. However, it's worth noting that sometimes your own sensitive fingertips can pick up these subtle irregularities even before a device does. Learning to check your pulse regularly is a simple yet powerful act of self-care that can provide crucial early detection for conditions like atrial fibrillation, enabling timely medical intervention and potentially preventing severe complications. Our 5th area of observation encourages you to watch your neck and fingernails, as these seemingly unrelated body parts can offer surprisingly insightful clues about the state of your heart valves. The heart contains several vital valves that act as one-way gates, ensuring blood flows in the correct direction through its chambers and out to the body. Among the most crucial is the aortic valve, situated between the left ventricle, the heart's main pumping chamber, and the aorta, the body's largest artery. Its job is to open fully to allow oxygenated blood to be pumped out to the body, and then close tightly to prevent any backflow. If this valve becomes leaky, a condition known as aortic regurgitation or aortic insufficiency, some of the blood that has just been pumped forward flows backward into the left ventricle instead of continuing its journey through the body. Over time, this constant back and forth sloshing of blood places an enormous extra strain on the left ventricle, forcing it to work significantly harder to maintain adequate blood flow. This chronic overload can eventually lead to enlargement and weakening of the heart muscle, culminating in heart failure. What is truly fascinating about significant aortic regurgitation is that its effects can sometimes be observed directly from the outside of the body, even without a stethoscope or advanced imaging. One of the classic signs is the presence of visible pulsations in the neck arteries, particularly the carotid arteries. With each heartbeat, you might notice a distinct, almost exaggerated throbbing that seems out of the ordinary. Even more subtly, if you meticulously examine your fingernails, pressing lightly on the nail bed, you might detect tiny rhythmic pulsations in the capillaries beneath the nail. This phenomenon is specifically known as Quincke's sign. Beyond these, some individuals with severe aortic regurgitation can develop even more unusual visible pulsations, such as rhythmic bobbing of the uvula, the small, fleshy projection hanging at the back of the throat, a sign called Muller's sign. Others might notice their head subtly nodding or bobbing with each heartbeat, a sign historically referred to as Musset's sign. While these external findings are relatively uncommon and typically indicate a more significant degree of aortic valve disease, their presence is an invaluable diagnostic clue. Recognizing any of these subtle rhythmic movements in the neck, fingernails, or head should immediately prompt a comprehensive cardiac evaluation, as early diagnosis and management of aortic valve disease can significantly alter its progression and prevent serious long-term complications. For our sixth sign, turn your attention to your hands and ask, what do your fingers look like? Your hands, often taken for granted, can unexpectedly reveal a surprising amount about your overall health, including insights into your heart and lungs. Try this simple yet revealing test. Place the backs of your two index fingers together, pressing them firmly nail to nail as if you were mirroring them. Now bring your thumbnails together in the same manner. Observe the space where the two fingernails meet at the base. In most healthy individuals, you should be able to see a small, diamond-shaped gap or window between the nails, particularly when viewing from the side. If you observe this small, diamond-shaped gap, that's generally a good sign. Now, compare your observation with an image of what this diamond gap looks like when it's present, and then contrast it with an image where it's absent. If that characteristic gap is missing, and the space is instead filled by the touching nail beds, you may be exhibiting a finding known as finger clubbing. Clubbing is a physical sign characterized by the enlargement of the tips of the fingers, and sometimes toes, where the nails curve downwards more acutely than usual, often resembling the round part of a drumstick. This condition develops over time and is typically a sign that the body has been exposed to chronically low oxygen levels, hypoxia, for an extended period. The exact mechanisms are complex, but involve changes in the small blood vessels and connective tissues at the fingertips, possibly due to growth factors released in response to chronic oxygen deprivation. While heart disease, particularly certain types of congenital heart disease that lead to cyanosis, bluish discoloration due to lack of oxygen, can certainly be a cause of clubbing, it's equally important to understand that many lung diseases are also common culprits. Conditions such as lung cancer, chronic obstructive pulmonary disease, COPD, cystic fibrosis, and bronchiectasis are frequently associated with clubbing. Less commonly, chronic liver disease, inflammatory bowel disease, and even some gastrointestinal conditions can also lead to this sign. Therefore, if you perform this simple test and find that the diamond gap is absent, suggesting the presence of clubbing, it doesn't automatically pinpoint heart disease. However, it is a significant general indicator that an underlying medical condition requiring further investigation into your cardiac and pulmonary health is likely present. It's definitely worth getting checked by a healthcare professional to determine the root cause and ensure appropriate management. Finally, for our seventh and last hidden sign, we turn our attention to your face. Check your eyelids. Take a good, close look at your eyelids, specifically around the delicate skin surrounding them. Do you notice any distinct yellowish patches, particularly situated near the inner corners of your eyes, closer to your nose? These distinctive yellow plaques are medically termed xanthelasma palpebrarum, or simply xanthelasma. They are essentially deposits of cholesterol that have accumulated just beneath the surface of the skin. The appearance of xanthelasma itself is not inherently dangerous or painful, nor does it directly signify that you already have heart disease in an active sense. However, its presence serves as a highly significant visual clue, acting as a potential external marker that your cholesterol levels or other lipids in your blood may be abnormal. Abnormal cholesterol levels, particularly elevated levels of low-density lipoprotein, LDL cholesterol, often referred to as bad cholesterol or high triglycerides, are among the most significant risk factors for the development and progression of atherosclerosis. Atherosclerosis is a serious, progressive condition characterized by the buildup of fatty plaques, primarily cholesterol, within the inner lining of your arteries. Over time, these plaques harden and narrow the arteries, restricting blood flow. This insidious process is the underlying cause of a wide array of cardiovascular problems. When these plaques affect the arteries supplying the heart, they can lead to coronary artery disease, which can manifest as angina, chest pain, or more critically, a heart attack if blood flow is severely blocked. If the plaques affect the arteries leading to the brain, they increase the risk of a stroke. Furthermore, atherosclerosis can affect arteries in the limbs, leading to peripheral artery disease. So, while xanthelasma itself is a benign skin lesion from a cosmetic standpoint, its significance lies in its potential role as a visible messenger. It's a compelling signal that it might be an opportune time, or perhaps even an urgent necessity, to have your cholesterol levels thoroughly checked by your doctor. This simple blood test can reveal a critical piece of your cardiovascular risk profile, allowing for early intervention through lifestyle modifications, dietary changes, and, if necessary, medication to manage your cholesterol and reduce your long-term risk of severe cardiovascular events. It is crucial to reiterate that the presence of any single one of these signs does not automatically mean you have heart disease. However, what they unequivocally are clues. These are the very same clues, the subtle indicators and physical manifestations that I, and indeed many other medical professionals, use every single day when assessing patients for potential cardiac issues. They are pieces of a larger puzzle, and when observed, especially in combination, they provide invaluable insights into your body's internal workings. Therefore, if you notice any of these signs in yourself, or if you recognize them in someone you care about, please do not ignore them. Dismissing such indicators can lead to delayed diagnosis and potentially more severe complications down the line. The most sensible and proactive course of action is to speak openly and honestly with your doctor or a trusted healthcare professional. Describe your observations and concerns in detail and ensure you undergo a proper medical assessment. The earlier heart disease is detected and diagnosed, the more effective and less invasive the available treatments often are. Early detection provides a critical window of opportunity to implement lifestyle changes, initiate appropriate medical therapies, and take preventative measures that can significantly slow or halt the progression of the disease, ultimately helping to prevent serious and often life-threatening complications later on. Your body often whispers before it screams. Learning to listen to these whispers can be one of the most powerful steps you take towards a longer, healthier life. Pay attention to your pillows, your stride, your ankles, your pulse, your fingernails, and your eyelids. They might just be telling you a vital story about your heart.